Welcome back. Here in Module 6, we'll be discussing staffing and HR management. So we've built this beautiful practice. We found the optimal location. We decorated it to the nines. Now we need people to work there, right? All right. So when we first start thinking about our staffing model, couple things. Let's start lean and let's start friendly. Lean and friendly. You want to embed your culture. What's in your heart as you lie awake at night dreaming of this clinic, this practice? You want what's in your heart to come out to your ideal customer, to your clients. Well, we need a team to do that because as lovely as you are, you can't do it all. You're already going to be a social media manager. You're going to be a community liaison. You're going to be a provider. You're going to be all the things. So you need a team to help do the rest of the work. So let's start thinking about what do we need to do that work? Well, we need someone at the front. We need someone to greet. We need someone to welcome our guests into our practice. We need someone to welcome them on the phone. So someone who's doing scheduling, someone who's greeting at the front. Now, in the beginning, that someone can be one someone. We want to start lean and friendly. So when we first started our practice, I was very adamant that I wanted what was in my heart was a family. So I wanted it to feel like family. So I made sure my team understood family so that they could make our patients feel like family. And I wanted it to be first name basis. Back in high school, I worked at Walmart, or maybe I was in college. And I worked at Walmart. And something you don't know is Walmart, it's first names only. Their big leadership team is first names only because it gives a more personal feeling. And so I really wanted everyone to know our first names. I go by Amanda. Nadia, my nurse, out of honor, she will say to my patients, Miss Gaskin, whatever, but I'm Amanda. I want it to feel like you can trust me. So I made sure that we went by first names and then that our patients knew. And so in the beginning, it was Amanda, Nadia, and Sarah. Very lean. Everyone kind of knew exactly what our roles were. In all of our social media posts, I used their names. I did introduction videos to the community of our team, of myself. And so it was lean and it was friendly. So that's very important. And when you're building your team is you want to embed the culture. What's in your heart you want it to come out, okay? When you're looking for those someones, you want to avoid places like Craigslist. You want to avoid even Facebook because you want someone to join your team that's going to represent you. And so the best referrals are from someone who knows someone. So if you're in any Facebook groups or you've got some group chats with other providers, start asking them, hey, I'm looking for a medical assistant. Do you recommend anybody? And get recommendations because that person most likely knows you. They know this person and they can make the introduction like a blind date. You want to get hooked up. On Indeed, you can put Indeed things out there, but have some very clear rules on Indeed. So maybe I think there's a way you can do like a questionnaire and then they have to answer the questions and it flows into, yes, it's a good candidate for you to meet with. And then maybe you want them to do like a little 30-second video that they could send to you that says why they might be a good fit to join your team. But you don't want every Tom, Dick, and Harry trying to join your team because they can make or break your practice here in the beginning. And right now, we need all the good juju we can stand. Okay? Training. Once we've got this team. So we've decided based on our services, what do we need? Just for example, when I started with Sarah, who was my front desk practice manager, but she was also the receptionist and she took the phone calls. Nadia is an LPN. Nadia would room patients. She started IVs. She drew labs. She did all of that. And then I was the provider. Now, over the last 3 years, our team has grown and we have a lot more people. We've got my mom, Miss Brenda, who remotely answers our phone calls so that the phone doesn't ring here in the office. It rings remotely and she does our scheduling for us. We've added a medical assistant who does our weight management program. So she's doing those weekly check-ins and medication administration. And then we have a weekend team. So we have a housekeeper now also that works with us. But those things we added, don't you start adding all that at the beginning. Lean and friendly. is how we start in the beginning. So just what you need to get the work done and efficiently. Now we've got our team. Let's bring them in for training. We need to train them. We need to embed what's in our heart into that culture. We want Chick-fil-A all day. So what I recommend and what I did was Nadia and I came from the same practice together. So I left 1 week before Nadia. I came down here, I started getting things together. I was making forms because in the beginning you're going to do it all. So I was creating forms and I was creating processes. And then the following week, Nadia came down and we did training. I was like, okay, Nadia, let's walk the patient walk. So they come in and it kind of goes like this. And we did that for a week. And then we opened a week later. Sarah actually didn't join us until maybe 2 days before we opened. And so we trained, one big thing was embedding what was in my heart into that team, and then having that training, doing those walkthroughs and just kind of like dry runs before we open the doors. So got the staff, or the team. Now we've done the training. Now we need to make sure that we stay legal, because this is a business, right? Policies and procedures. So we need to get some HR, some human resources handbooks together. This is not something you need to create on your own, my dear. Do not recreate the wheel. There are platforms like ADP and Gusto, who they have a whole HR platform right there for you. It's really plug and play. Like you just create your account, you say what you need and take the services that you need. So if you need payroll management, you need benefits administration, if you need a handbook created, those two are the main ones. There's several others, but those are two heavy hitters who can really help you get those things in order so that you can check that compliance box, because we want to recruit a quality team. And in recruiting that quality team, they need a paycheck. And so we need to make sure that the payroll, that they're getting their paychecks, that they're getting direct deposit. Let's do big business. I know a lot of business owners in the beginning will start with writing personal checks out or business checks out, and then trying to go back on the back end and fix things. We want to attract people into our practice. We want to do it right the first day so that we don't have to go back and clean it up. So we personally here, we use ADP. I did not start with ADP. I started with another. Can't remember who it was. It didn't work for us. I believe it was, honest to goodness, I don't remember. ADP is who we have now. ADP does my payroll. ADP does my benefits administration. And in offering benefits, even in a small practice where there were just 3 of us, from day one, there was 401k available for my team. There was, what are those, like cafeteria plans, like, what's it called? AFLAC, those things were available to my team day one, because you want a quality team that's being compensated properly so that they're not disgruntled, and that translates to your customers. Okay? Got it. So pitfalls to avoid: not paying fairly. Let's pay people their worth. I remember I had a supervisor when he interviewed me, and he said, Amanda, what is your salary requirement? He said, now, I can't pay you what you're worth, but what's your salary requirement? And I like that lingo. So I always told my girls, I can't pay you what you're worth, but what's your salary requirement? And if we could meet in the middle and say, we're starting, if we can start here and you'll be okay. And then as we grow, I will promise you that we will add to that salary. People are willing to do whatever. They'll go to the end of the world with you if they're paid fairly. So let's pay fair straight out the gate. Pitfall number 2, undervaluing your team. You are not the end all be all, Michael Jackson. You need a team. So yes, it's my name on the marquee. Yes, it's me in the videos. But I could not do this if Miss Brenda wasn't answering the phones. I could not do this if now Nadia was not drawing the blood. So you need your team. So let's avoid undervaluing our team from the beginning, because if you give them your all and you value them, they will give you their all. My team has bought into this dream, and we are doing as well as we're doing financially because they believe in what we're doing. It's not just about making Amanda rich. Okay. And pitfall number 3, not practicing before the game. Let's get your team in there. Let's get them trained so that on the first day, we're not fumbling. We opened on our first day at 8:30. My very first patient was in here by like 9:15. She called and said, could she get an IV drip? And I said, sure. And so she came in and we kind of did all the things. And by the end, she became a direct primary care member. I wasn't exclusively membership at that time. So she came in for one thing, she stayed for another, but it's because we'd practiced. We were ready. We were game day ready on that first day. So those are things I want you to keep in mind. When we come to benefits, also, I wanted you all to consider benefits for your team. Something that I do for my team is I give them free membership to DPC. I make sure that they are the first partakers of the fruit. So my team is a DPC member from the first day. They have their physicals with me. They get their blood work with me. I send them for their mammograms. We've even done their pap smears here in the office, because I don't need my team having heart attacks and strokes when we're taking care of everybody else. So let's take care of our team, and that's free. As we've added extra benefits or services here, one of the things that I give to my team is they get discounted services. So they only pay if they want something like Morpheus. They would only pay what it costs me, the consumable for Morpheus. So say Morpheus cost me to do the service, it cost me $150. That's all they would pay is the $150. They wouldn't pay the package price of $2,500. Or if they wanted Botox, they would pay just what it cost me, a couple bucks for their Botox. So that's another lovely benefit. And also it's good marketing, because in your videos, you're showing you doing your services on your staff. Also, they're walking around looking like little spokesmodels. One of my favorite stories is my newest team member, Sony Vet. Sony Vet came in and she said, I'm going to be an Ultimate Health Barbie. And I said, okay. Sony Vet has lost 83 pounds right before the camera's eyes and our patient's eyes. Sony Vet's gotten Botox. She's gotten Morpheus. She's gotten all the things, O-Shot, and so that she could talk about it. So when someone asks her, well, girl, what'd you do? She can raffle it right off. So treat your team, treat your staff. I'll see you in the next module.